Hello students, in this lecture we will discuss about metabolic acidosis. Metabolic acidosis is a condition in which acids other than carbonic acid is accumulated inside the body as a result of deranged metabolism. That's why it is metabolic acidosis. There are mainly two types of metabolic acidosis. Normal anion gap metabolic acidosis and second one is increased anion gap metabolic acidosis. First of all, we will discuss about normal anion gap metabolic acidosis. In normal anion gap metabolic acidosis, we will measure sodium level, potassium, bicarbonate and chloride, and we will calculate their difference. And its difference is usually between 5 and 11 millimole per liter. If this is more than 11, it is increased anion gap metabolic acidosis, and if it is less than 5 to 11, it is normal anion gap metabolic acidosis. The normal anion gap metabolic acidosis, the examples are infusion of inorganic acids. Similarly, GIT, loss of bicarbonate, i.e. in diarrhea. In diarrhea, there is loss of bicarbonate, and there is normal anion gap metabolic acidosis. Similarly, renal tubular acidosis. In renal tubular acidosis, there is normal anion gap metabolic acidosis. The second one is increased anion gap metabolic acidosis. Examples are diabetic ketoacidosis, lactic acidosis, starvation acidosis, and alcohol ketosis. In all these conditions, the anion gap is more than this normal level. So these are increased anion gap metabolic acidosis. There is also a third condition in which there is infusion of exogenous acids, and there is also increase in anion gap. For example, methanol and aspirin. In this condition, also increase in anion gap. The ketoacidosis is exacerbated by catecholamines and stress hormones. Lipolysis causes the exacerbation of this condition also. Ketoacidosis is exacerbated by catecholamines and stress hormones. These conditions will exacerbate the ketoacidosis hormones. Similarly, lipolysis also causes the exacerbation of ketoacidosis. Now we discuss about lactic acidosis. There are mainly two types of lactic acidosis. Type 1 is occur due to hypoxia. In hypoxia, there is decreased supply of oxygen to the cells. As a result, there is increased lactic acids. So there is lactic acidosis type 1. It is usually occur in circulatory failure and shock. Circulatory failure and shock. Similarly, the type 2 lactic acidosis is occur due to impaired metabolism. For example, in liver disease. The metabolism is impaired. As a result, lactic acid accumulated inside the body and cause type 2 lactic acidosis. Now we will discuss about investigations of a suspected case of metabolic acidosis. First of all, we will measure blood gas, which is also known as ABG. Similarly, we will measure creatinine, urea, electrolytes. Now, similarly, we will measure chloride level. in hyperchloremic acidosis, hyperchloremic acidosis, the RTA is suspected, usually suspected. So we will measure chloride also. Similarly, we will measure anion gap, anion gap and urine pH. Urine pH is usually 5.5, and with systemic acidosis, greater than 5.5 with systemic acidosis. Similarly, we will measure GFR for renal impairment, for in RTA. Similarly, we will measure ketones. Now we will discuss about management of metabolic acidosis. In management of metabolic acidosis, first of all, we will identify the cause. Identify the cause and correct it. Okay. Then, for example, if there is diarrhea, we will control diarrhea, treat diabetes for diabetic ketoacidosis. Similarly, we correct shock in lactic acidosis. Similarly, we stop drugs, for example aspirin. Similarly, we will do dialysis for what? For toxins. Similarly, we will resuscitate the patient accordingly. We also give IV glucose in alcohol ketosis and starvation ketosis. Now, if there is if the hydrogen concentration is more than 100 millimole per liter and pH is less than 7, then we also give bicarbonate, IV bicarbonate. So this is all about metabolic acidosis. Thanks for watching.